Good afternoon and welcome back to the daily briefing at St. Clair County EMA, where I'm joined with Sam Behrman from the Health Department and Chairman Mark Kern, and it's good to be back, and I'm glad to see that everybody is still tuning in, at least for a couple more days. Sam?
Well, we are certainly glad to have you back, Herb.
Thanks, Sam.
As of today, 14,821 St. Clair County residents have been tested, with 1,896 positive test results, which is an increase of 27 from yesterday, and that does include both males and females from their 20s to their 100s. We are at 12,803 negative test results, with 122 results still pending, with 136 deaths, which we are happy to announce that no new additions were made to that number today. For those who have completed their required IDPH 14-day quarantine, we are at 1,410. For state totals, 1,460,527 have been tested, with 139,434 positive test results, which is an increase of 894 from yesterday. And we are at 6,810 deaths for the state, which is an increase of 41 from yesterday. For our hospitalization numbers, and these are for hospitals in St. Clair County, currently we have 27 patients that are admitted due to COVID-related reasons, and 2 of those patients are on ventilators. A side note about our hospital numbers, since we have started reporting on hospitalization numbers on April 15th, we have never been this low. So we are very happy to see numbers this low today. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Atrium of Belleville has 2 cases and no deaths. Brea of Belleville has 51 cases and 6 deaths. Brea of Cahokia has 25 cases and 2 deaths. Caritas Family Solutions in Belleville has 12 cases and no deaths. Caseyville Nursing and Rehab has 4 cases and no deaths. Cedarhurst of Shiloh has 13 cases and no deaths. Cedar Ridge of Lebanon has 71 cases and 10 deaths. Cedars of Lebanon has 2 cases and no deaths. Colonnade Senior Living in O'Fallon has 5 cases and no deaths. The Esquilin Dammert Center at the Shrine has 2 cases and no deaths. Four Fountains has 104 cases and 27 deaths. Help at Home in Belleville has 2 cases and no deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville has 8 cases and 1 death. Lebanon Care Center currently has 56 cases and 10 deaths. Memorial Care Center in Belleville has 44 cases and 5 deaths. Mercy Rehab and Care Center in Swansea has 2 cases and no deaths. New Athens Home for the Aged currently has 57 cases and 7 deaths. St. Paul's Home in Belleville has 49 cases and 14 deaths. Swansea Rehab and Care Center has 29 cases and 6 deaths. TDL Incorporated in Belleville has 4 cases and no deaths. And a new addition to our list today, Willow Creek Nursing and Rehab has 2 cases and no deaths. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. So we continue to see great numbers that Sam's giving us. Tomorrow we move into phase 4. That means a lot more things are going to be open, a lot more opportunities out there. But there's also an opportunity then to maybe let down our guard, and we don't want to do that. So let's continue to wear masks. Let's continue to wash our hands, social distance, all those things that we've been talking about so the numbers stay low so that we continue to move forward from phase 4 into phase 5, and we don't want to go backward. That's the key here is that we want to continue to keep things going as they are. The numbers are getting better, and that's a good thing. We'll move into our zip code report. Remember, if you don't hear your zip code, doesn't mean you don't have a COVID positive diagnosis in your zip code. What it means is that your zip code doesn't have more than 5 of those people yet. In 62059, we remain at 7. 62201, we go up 3 today to 81. 62203, we go up by 1 to 62. In 62204, we remain the same at 63. In 62205, we go up by 5 today to 74. 62206 goes down by 1 today to 157. Remember, there are shifts of numbers if someone moves from one zip code to another, or if they're checked into a facility, maybe give an incorrect zip code. That's the reason for those changes. We do that so we have absolute accuracy with the numbers in the zip code. And these are cumulative numbers of people since we started keeping track of COVID numbers. 62207, we go up by 2 to 108. 62208, we go up by 2 to 102. 62220 goes up by 2 to 160. 62221 remains the same at 157. 62223 goes up by 1 to 70. 62226 goes up by 3 today to 203. 62232 goes up by 1 to 35. 62239 remains the same at 18, as does 62243 remain the same at 10. 62254 goes up by 1 to 93. 62255 remains the same at 7. 62257 is also static at 13. 62258 remains the same at 18. 62260 is also the same at 12. And 62264 remains the same at 56. 62269 goes down by 1 today to 94. And 62285 remains the same at 20. Herb Simmons, it's great to have you back. I gotta say, you picked a heck of a time to get a facelift, but now that that's completed, you look better, and so I think it was probably all worthwhile.
Well, I'm glad to be back, and appreciate the job you and Sam and Brian did keeping the briefings going, because I was able to keep up with them somewhat, and I want to thank all of the members of Team St. Clair out there who has joined the team that you have assembled, which will be 105 days tomorrow. And I encourage everybody to spread the word to tune in tomorrow, because we're going to kind of give an update on how we're going to proceed moving forward, and kind of a synopsis of what's happened over the last 105 days. For some of you who are maybe new, it just maybe the last couple of days or weeks following the briefings that we're doing. As the chairman said, we're not out of the woods yet. Can't let our guard down. If you listen to any of the news media, you'll see there's states all around that are going backwards. And boy, knock on wood, here in St. Clair County in the state of Illinois, we are fortunate to keep those numbers down, as Sam has said. And it's all because each and every one of you that are taking it serious. Pat yourself on the back for being a part of that team of keeping us moving forward. On the EMA side, we had 34 agencies pick up PE equipment today. We still have those supplies. We'll continue to do that to our first responders, also to our health departments, working with them in the long-term health care facilities, doctors' offices, dentists, whatever needs to be done. We're going to be here for them. A couple of weeks ago, the chairman had announced that we were going to come up with a program to help our food banks throughout the county. We were able to start that today. We went out and visited 8 different communities, those being Brooklyn, the Community Lifeline in East St. Louis, Caseyville Food Pantry, Fairview Heights Food Pantry, Swansea, O'Fallon, Lebanon, and Fairmont City, in care of the St. Vincent de Paul. We were able to issue their checks that you were able to reallocate that money, and I'll tell you, everybody was so helpful and supportive of that. Tomorrow we've got about another 8 throughout the rest of the county that will report on them tomorrow, but everybody was really appreciative. Some of those food banks were had a few bags left. This is a time that really come in handy for them.
And so, just because that money was given, remember to get out there and donate to your local food bank. The need is huge, and it's going to remain that way through at least the remainder of the year. And then, of course, there's always a need for food banks. There's always people who have issues and problems, and that is certainly a lifeline that's necessary.
And one of the things I wanted to just talk about today a little bit, I noticed yesterday with the school guidelines coming out, you did a great job on explaining that, but a lot of people following the briefings seem to be aggravated. They want answers right now, and you clarified that they had just came out, Susan had just received that information. The superintendents, they have to have time to go over that document, and once they get a plan put together, I mean, let the kids enjoy a break right now. Keep them safe, but they will come back and let us know what type of plan each district's going to have. There was quite a few people angry on there last night. Well, why wasn't this answered? Well, if we had the answers, we'd be telling you. So, but believe me, they'll come up with a plan for each school district in the county, and the parents is going to be the first to know about that. So we appreciate, like I said, everybody following the briefings. We'll give you an update tomorrow on how we're going to proceed forward at our 105th day tomorrow. We'll be back momentarily with Cindy and Daisy to translate this into our Spanish communities, and we'll see you tomorrow afternoon at 3:30.